Hello and welcome back to Cancer Watch, where we shine a light on the critical issues in cancer awareness and prevention. It is a public health program on cancer brought to you by the Cornwall Cancer Foundation and partnered with OACON, proudly sponsored by Plus TV Africa. I am Denise Ejo, CEO of Cornwall Cancer Foundation, and I'm honored to have you join us today for this crucial conversation on esophageal cancer, a disease that affects thousands but is often overlooked in early diagnosis and treatment. Together we fight, together we win.
And hello everybody, I'm Dr. Sunday Olusegun, your co-host and the representative of AFCON. We're proud to stand alongside Commod Cancer Foundation and Plus TV Africa in creating a space where education meets action. Today, we will be demystifying esophageal cancer, what it is, what causes it, and how we can take proactive steps to reduce its impact.
We are deeply honored to welcome our guest today, Dr. Ismail Zubair. He is a consultant and head of radiation and clinical oncology at Ahmadu Bello University Teaching Hospital, Zaria. Dr. Zubair, thank you for joining us on Cancer Watch.
Thank you very much for having me. It's a pleasure to be here with you to participate in this important conversation.
Thank you.
Thank you, Dr. Zubairu. An impeccable gentleman, Dr. Ismail H. Zubairu is a consultant radiation and clinical oncologist and the current head of Department Radiation and Clinical Oncology at the Ahmadu Bello University Teaching Hospital, Zaria. He is a passionate clinician with about 10 years experience in cancer treatment, and some of his research interests are in the area of cyto-oncology and, of course, public health, which explains why he's here with us today. So let's begin the conversation. Please share, follow, and subscribe to the Commod Cancer Foundation social media sites and YouTube. Thank you very much.
So sit back, relax, and here we go. Doc, now you see this word is going to be quite hard for me, so I'm going to try again. What is esophageal cancer and how does it develop? I tried.
Right. Thank you very much for having me again. Esophageal cancer is simply a cancer that develops in the esophagus, also known as the gullet for those of us who are more familiar with that terminology. The esophagus is a tube that connects the mouth to the stomach. So essentially, it transmits from mouth into the stomach. As for how a cancer develops in the esophagus, just like cancer anywhere else in the body, it develops as a result of a mutation in the cells of the esophagus. This mutation causes the cells to be unresponsive to the normal growth signals of the body. These growth signals prevent the cells from overgrowing and overpopulating the region where they are supposed to occupy. As such, a tumor develops there. And this tumor can cause a lot of discomfort and several other symptoms, as we will see as the program progresses.
Thank you.
Oh, wow. Thank you so much, Dr. Zubair. I mean, I kept feeling my neck as you spoke about it, and I'm like, the gullet. Yeah, you know, it's a pretty important pathway because...
Yeah. You see what
it's a pretty important pathway.
He's checking. Me, I'm not a medical doctor. I'm checking. He's a medical doctor.
You know, the way he described it, I'm just like, okay, yeah, you know, touch your neck, you know, and then touch wood. So, Dr. Zubair, let me just quickly ask you this. How common is esophageal cancer And while you're asking that, can you also tell us who are the people who are most likely at risk of developing this disease?
Well, globally, cancers of the esophagus account for the sixth most common cancers, and it is the seventh leading cause of cancer death worldwide. So it's pretty common, given the possibilities of sites that cancers can arise from. Esophageal cancer occupies the sixth position, and the seventh cause of cancer-related deaths. In sub-Saharan Africa and certain other regions, especially in Asia, the incidence has been found to be a lot more in those areas. There is the esophageal belt, Asian esophageal belt, and the esophageal cancer African corridor that comprises of countries like Malawi, Eswatini, Zambia, and Zimbabwe. Research has shown that the incidence of esophageal cancer in these countries are much higher than in other regions of the world. In addition, esophageal cancer is common in men.
Oh, then it's a big
several factors.
Go on.
Okay, right. So the reason for this can be attributed to several factors like lifestyle and diet. So yeah, people who are heavy drinkers of alcohol are more at risk of of developing esophageal cancer. Similarly, it's been found that heavy consumption of red meat, especially processed red meat, such as bacon, such as sausages, in excess of about 500 grams per week. That's the cooked weight, not the raw weight of the meat. So the cooked weight, in excess of 500 grams per week, is associated with several cancers of the gastrointestinal tract and some other cancers. So these are some of the risk factors associated with developing esophageal cancer.
Okay, thank you so much.
This is very serious education we're going through now.
Okay.
So, based on what you just said now, what are the symptoms and how can it therefore be caught early? Because I'm listening to you saying, okay, certain types of foods. Yeah, okay, I can agree with that. But considering it's gone to number seven in the world, it's hard to understand that. So what would the symptoms be that will reduce that 7 to that's 7 is scary.
Yeah, true. It's quite serious business, really. I'll start with the symptoms. So, esophageal cancer in early stages can present, as non-specific symptoms related to the chest, the abdomen, as to where you have some, sensation of tightness, maybe burning sensation in the chest. And sometimes this is diagnosed as ulcer and keep in ulcer repeatedly because there aren't standard screening modalities to establish diagnosis early. So besides these non-specific symptoms, you can have more serious symptoms like difficulty in swallowing. You can also have pain when swallowing. And as the disease progresses, there could be cough that could be associated with producing blood-stained sputum, unintentional weight loss, just suddenly start losing weight. You're not dieting, you're not exercising per se in order to lose weight, and all your previously well-fitting clothes become loose-fitting. So these are some symptoms. look out for, if there's a suspicion of esophageal cancer. As for detecting it early, endoscopy is valuable in this respect. So patients or other people who have a history of acid reflux, for example, which is also a well-known cause of Barrett's esophagus. Barrett's esophagus is a condition that eventually progresses to esophageal cancer. An endoscopy can be done for have chronic acid reflux to detect early if there are any abnormal lesions or abnormal tissue in the esophagus that require a biopsy. A biopsy is simply taking a snip of the tissue and subjecting it to a microscope test analysis to determine if the cells are cancerous or not. That is one way to diagnose them early.
Thank you. Thank you. You are giving us a bit to think about. I'm going to be very honest. So we're going to take a break. And when we come back, we'll continue this conversation. Thank you all for staying with us. This is Cancer Watch. We'll see you shortly. Thank you. Welcome back to Cancer Watch with Dr. Denise Ejo, the CEO of Conwood Cancer Foundation. We're continuing this conversation on esophageal cancers. My viewers, I'm not a medical doctor. I am a cancer patient, and it's not this type of cancer. Let's keep going. So the next question, Dr. Zubair, is how does diet, lifestyle, and environment contribute to this risk, and are there ways to reduce the risk of this cancer?
Right. As for diet in the position of esophageal cancers, I don't know if I mentioned earlier that excessive alcohol consumption is a significant risk factor for developing esophageal cancer. Similarly, excessive consumption of red meat, especially the processed red meat, also is significant because alcohol consumption, smoking constitutes certain types of lifestyle, I guess. So cutting down on alcohol consumption be a preventative form of action from developing esophageal cancer. Similarly, moderation in consumption of red meat is also, on the positive side. Making sure your diet has a healthy amount of vegetables and fruits that contains a lot of fiber and antioxidants are also a protective, form of dietary lifestyle that can help protect against esophageal cancer. Exercise cannot be overemphasized because obesity has been linked to several types of cancers, including cancers of the gastrointestinal tract, where the esophagus also belongs. So exercise, maintaining a healthy weight, making sure your diet contains a lot of fruits and vegetables, and then moderate consumption of alcohol and processed red meat lifestyle changes that
Thank you. I find it very interesting, and I'm going to hand over to Dr. B to continue. But I always hear this thing about losing weight. And it's very interesting because when I got diagnosed with cancer, I wasn't losing weight, and I was straight to stage 4. So that's very interesting. This losing weight concept. I think I'm going back to my consultants. All of you guys should go and do research. Why didn't I lose weight? Keep going, Dr. B.
Right. I would believe that one of the reasons why losing weight is a big part of this is because it's a gastrointestinal tract disease. So your nourishment, your nutrition are a big part of this particular cancer that we're discussing. And weight loss, of course, can be in your case though begs for us to take a closer look indeed that you should go back to your doctor. Thank you, Dr. Zubair, and everyone watching. We're glad that you're still there. Dr. Zubair, we were talking earlier about the fact that a lot of times patients with esophageal CA are actually suspected as having ulcer, and that for a long time they may be treating ulcer. I'm wondering, I will quickly, if you've been having dyspepsia or ulcer symptoms, should you be overly worried that this could be an esophageal CA? And what steps should you take if perhaps your symptoms have persisted for so long? And when someone is diagnosed with esophageal CA, what treatment options are available to them? Thank you.
Right. Yeah. So excessive worry isn't so much advocated for any condition at all. The more important thing to do is to educate oneself about steps to take to address whatever symptoms is bothering you, like you have rightly alluded. If someone has had dyspepsia for long periods of time and it's not resolving, it's important to present to a specialist, preferably a gastroenterologist, and lay your complaints to them, telling them the duration of your symptoms, and they would go ahead to order an endoscopy for you, and an endoscope will immediately rule out the possibilities and establish a diagnosis. I wouldn't say any patient that experiences upper abdominal pain should be worried that they have esophageal cancer right away. There are several steps that need to be taken to arrive at that particular diagnosis. And if in the event that one is diagnosed with esophageal cancer, there are several treatment modalities available. The reality of our health system is such that most of these treatment modalities are only available at the tertiary health facilities, where your treatment will be taken on by a group of specialists in a setting called the multidisciplinary team setting. So this will involve surgeons, will involve pathologists, radiologists, radiation and clinical oncologists like myself and Dr. B, in the treatment of esophageal cancer. Several modalities are available for treatment depending on the stage of the disease and other characteristics. The stage simply means, how far gone the disease is. Is it still early or is it late? The earlier the disease is detected, the easier it is to treat, and the more treatment modalities and options available to treat it. However, patients who present with an advanced disease also have, there are also treatment modalities that they can benefit from. Examples of these treatment modalities, of course, include surgery, where the tumor is excised, the tumor alone or with a segment of the esophagus, such that you remove as much out of the disease as is possible. And then secondly, the other form of treatment available is chemotherapy and radiotherapy For esophageal cancer specifically, the recommended modality of treatment is to combine both chemotherapy and radiotherapy, what is known as concurrent chemoradiation. And this tends to give a relatively good outcome for patients with esophageal cancer.
Right. Thank you so much, Dr. Zubir. I remember you mentioned about smoking. And I remember I'm aware that a combination of alcohol consumption and smoking can actually sort of like multiply or amplify risk factors. So for someone who is smoking and as well as consuming alcohol in significant amounts, their risk will probably be higher. Do you think we're doing enough to legislate smoking and drinking? And would you be able to, what can our local authorities do, so that they can play a very good role in improving esophageal cancer care, esophageal cancer awareness, and its treatment, Dr. Zubair?
Yeah. So, I think all forms of healthcare should really start from the grassroots. So, our primary healthcare facilities need to be, optimized. And the healthcare professionals who are manning these stations need to be trained, educated, to be able to, have a high index of suspicion for the symptoms that patients present with. So if a community health extension worker, for example, or a community health officer, or a nurse, for example, in a primary healthcare center sees a patient who repeatedly comes to the primary healthcare center with something that looks like ulcer, if they know that there's a possibility that this can be early, esophageal cancer, they will be, they will be in a position to refer them to a tertiary facility or any other facility for that matter, where they can get an endoscopy done so that a definitive diagnosis can be made. So education, like this program that we are participating in, a wide reach, to people who have access to, the media that this interview will be streamed on, serves as a great source of education for the people. And when they know, that is when they are able to engage their local health authorities, their councillors, their local government chairmen, their ward heads, their village heads. They have town hall meetings every now and then, or they have small community meetings every now and then. If they have information, then they are able to impress upon their community leaders on the need for, empowering their communities to be able to detect some of these health challenges and act, appropriately, immediately. From the grassroots primary healthcare, centers to secondary healthcare facilities, which are general hospitals, and then the tertiary healthcare facilities. It's also important that our healthcare facilities are, equipped sufficiently to be able to treat, because there is no point detecting a disease early and you don't have the facilities to treat. You're identifying a problem and you don't have the resources to manage it or to treat it. It's work done zero. So I think the work has to be collective and, a holistic approach from bottom to top so that the problems are addressed as a whole.
Thank you. And as we draw to an end, I really want to say, I've learned something today that it's quite interesting when I look at it from a layman's perspective. But you've made it very easy. So we're going to end this conversation, and just before we end, in one sentence, what would you say to anyone now watching this program? In one sentence, it's one of the things that I found is, maybe because I'm a teacher, the shortest thing you say to someone is somehow always the thing you remember the most. Then they go back to think about what brought about that sentence. So a sentence that will help us to close this conversation this afternoon, today.
Keep watching this program to educate yourself about cancers.
Oh, thank you. Thank you very, very much. Dr.
Totally brilliant. Totally brilliant. Thank you, Dr. Zubair. I think that was just brilliant. Really, really good. Thank you. And today, everyone, we took a deep dive into esophageal cancers, shedding light on a lesser discussed but yet very life-threatening disease. We have explored the types, the causes, the symptoms, risk factors of esophageal cancer, and we emphasize the urgent need for early detection and that there is a need for community education so that it can be detected early.
We are very honored to have had you join us today, Dr. Ismail Zubair. We really appreciate you, and we say thank you for providing this powerful insight into the clinical realities of managing esophageal cancer in Nigeria. You highlighted the challenges.
Thank you very much for having me.
And the advances of treatment and how individuals and communities can act early to reduce risk. So we really, 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 really appreciate you.
Indeed. Thank you, Dr. Zubair. Let's note
Thank you very much.
Cancer doesn't wait.
It's been my pleasure.
Fantastic. Cancer doesn't wait for everyone. We shouldn't either. Understanding the signs, seeking help early, and spreading awareness can save lives. At the Covered Cancer Foundation, we believe knowledge is the first step towards healing. Together, we can turn awareness into action.
And with that in mind, we say we can make a difference too. You can make a difference too. So share this program, talk to friends about the symptoms, volunteer to cancer foundations across Nigeria, and let's break the silence about esophageal cancers together. It's my call to action as the CEO of Common Cancer Foundation. Follow us on any of our social media handles, Twitter, Instagram, Facebook, our YouTube, where this program will be on air for you as well to watch when we go on live tomorrow at 8 o'clock or tonight at 8 o'clock.